Well, welcome. My name is Rose Drew. I'm the CEO of Interfaith Glasgow, and a very warm welcome on behalf of Interfaith Glasgow to the penultimate event in our series, Voices from the Portal, Reimagining Our Post-Pandemic World. Thank you for being with us. I know we've got many new friends from New York with us today. Congratulations on your new president, as well as plenty of friends, old and new, from Glasgow and elsewhere in the UK and beyond. Welcome all of you to this international conversation. For those of you not familiar with Interfaith Glasgow is a Scottish charity that promotes and facilitates friendship building, dialogue and cooperation between people from diverse religion and belief communities. Since the pandemic hit the UK, all of our events and activities have been online. And while of course that's presented challenges, it's also been really exciting to be able to engage internationally, hosting events with speakers based in other countries and taking part in interfaith conversations with people from all over the world. A silver lining indeed. So wherever you are today, and whether you're an old hand or joining us for the first time, thank you for being here. You are most welcome. Now, as Magdalene already mentioned as people were arriving, if you're willing and able to rename yourself so that your name displays and then your country or your organization, if you'd prefer, then that might be quite nice for us to be able to see where people are from. So if that's easy for you to do, then maybe think about doing that. Our Voices from the Portal series has been inviting people of all backgrounds to come together to reflect on some of the key issues that have been highlighted by the pandemic, to consider what we've learned, what opportunities have emerged, and what changes we want to see in relation to key issues ranging from poverty, racism, and the cultivation of kindness, to the climate crisis, changes in religious practice, and today, mental health. Our aim has been to create contexts for conversations in which a variety of religion and belief perspectives can be heard, and where people can engage intentionally and deeply across religious and cultural boundaries to address crucial issues that affect us all. Although we are unfortunately still very much in the thick of the pandemic, with the numbers of lives taken by COVID-19 still rising at an alarming rate and the effects of lockdowns biting ever deeper, the rollout of the vaccine programme means we can at least begin to focus on the light at the end of the tunnel and on how we might help shape the world in which we will emerge. As I've explained at the start of previous events in this series, the series title, Voices from the Portal, was inspired by the words of Indian writer Arundhati Roy. Those of you who have attended all the events in this series might by now know the quote by heart. She writes, "Historically, pandemics have forced humans to break with the past and imagine their world anew. This one is no different. It is a portal, a gateway between one world and the next. We can choose to walk through it, dragging the carcasses of our prejudice and hatred, our avarice and dead ideas, our dead rivers and smoky skies behind us. Or we can walk through lightly, with little luggage, ready to imagine another world and ready to fight for it." So here we are again today with another opportunity to imagine our world anew and to listen to each other's ideas about how we might bring that world into being. It's a pleasure and a privilege to be delivering today's event in partnership with two impressive New York-based organizations who have already been very much involved in discussions about the intersection of faith and mental health in relation to the impact of COVID-19, the Interfaith Center of New York and the Psychotherapy and Spirituality Institute. The Interfaith Center of New York, ICNY, is a non-profit organization which works to overcome prejudice, violence, and misunderstanding through engagement with New York City's grassroots religious and civic leaders and their communities. Founded in 1997, ICNY encourages collaboration amongst New York's diverse communities in addressing the city's pressing social problems and promotes mutual understanding and grassroots cooperation. The Psychotherapy and Spirituality Institute, or PSI, also a non-profit organization, was founded in 1975 and provides psychotherapy, counseling, training, and continuing education to address emotional and spiritual health. PSI staff includes psychologists, pastoral psychotherapists, clinical social workers, spiritual directors, interfaith clergy, and practitioners from numerous other disciplines, and it hosts a wide variety of services for a broad range of individuals, groups, and communities. On behalf of Interfaith Glasgow, thank you so much ICNY and PSI for working with us to devise and deliver today's programme, a programme which I, for one, am really excited to see unfold. So without further ado, I'll hand over now to Dr. Henry Goldschmidt, Director of Programmes at Interfaith Centre of New York, who will introduce today's theme and speakers. Thank you, Henry.
Thank you, Rose. Really much appreciated. It has been a huge pleasure for us at the Interfaith Center to work with our new colleagues in Glasgow, with Rose and Magdalene and Katie and the whole team there. As you said, a real silver lining of this brutal pandemic. I'm very much looking forward to getting out of my study and seeing more of my friends and neighbors in person. But it's a nice advantage of life on Zoom that it's so easy to have a conversation like this, across faith lines and also across national lines. I'm just delighted, actually, just looking through people posting their names and locations in the chat. We don't just have New York City and Glasgow, but we have Saudi Arabia, Northfield, Minnesota. We're all over the place, but coming together here. I'd like to say, with our neighbors near and far. I've always sort of understood the Interfaith Center's work as bringing together neighbors across faith lines. But I think that term neighbor can usefully be extended, far beyond my neighborhood here in Brooklyn. So it's really a huge pleasure to be here. I'm going to talk for just a few minutes, hopefully, maybe 8 or 10 minutes. And I want to do 3 different things very quickly. First, as Rose said, I want to kind of introduce the theme of today's program by talking about the relationships between faith and mental health during the COVID pandemic and beyond. Really, I'll just barely scratch the surface, and I'll rely on our fantastic panelists to bring the conversation into greater depth. And then I want to briefly introduce our panelists. And then I'll also, at the end, I'll say a word or two just about the format of today's program, so we'll all kind of know what we're doing and what to expect. The one thing I'm not really going to do in these brief remarks is to talk in much detail about the mental health impacts of the COVID pandemic. To be totally frank and honest, this has been a huge issue for me and my own family, very personally. The mental health challenges of the past months have been daunting for my family, for my kids. And honestly, if I go down the rabbit hole of sort of talking about that in detail, there's no way I'll limit my remarks to 10 minutes. But suffice it to say, in the US, the UK, and elsewhere, I think we really have been facing a twin pandemic of COVID-19, of course, and also at the same time of widespread mental health challenges. What I would like to do very briefly is to discuss the role of our diverse faith traditions and communities in addressing this mental health crisis. And there is both good news and bad news on that front. There's the good news and bad news about the relationships between faith and mental health. The good news, I think, is that all of our diverse faith traditions include profound and important resources for supporting mental health. The tools that we need to support wellness and mental health are there in every faith community, in our scriptures, in ritual, in the rhythms of everyday community life, in the loving presence of clergy and lay leaders, and in the work of faith-based mental health professionals like today's panelists. Just by way of sort of quick illustration of some of these resources, I want to share on screen with you. I hope everyone can see that. These are just some selections from quotes from diverse scriptures and spiritual teachers that the Interfaith Center of New York has put together in a social media kit that we developed earlier in the pandemic to provoke discussion of mental health issues, in diverse communities during the pandemic. And I'm not going to read all these. I'll just kind of put some of these on while I'm talking. I'm not going to read them or discuss them in detail. But just one thing to flag, I love this phrase. This is a passage from the Quran. where, Allah assures the prophet that, God can remove the burdens that weighed down your back. And just to think, someone who's dealing with mental health issues in their own life or in their family, to have their faith tradition assure them, after hardship, there is ease. Most certainly, after hardship, there is ease. That's what people need to hear. And that's, I think, the voice that faith communities can bring to mental health issues. So I'll put a few of these other quotes up. And also, I'll let you know, I'm glad to share a link through the chat. I'll put a link to this whole social media kit in a moment. So if you'd like, you're welcome to download these graphics and some other materials and use them in your own faith communities if you find these materials helpful. So that's the good news. Scripture quotes are just the start of it. There's extraordinary resources in every faith tradition to support mental health. The bad news, though, is that there are also huge barriers to effective mental health care in many faith communities. I'll just go through a few of them, but there's too many to address quickly. There are really challenging communication gaps between mental health care providers and people of faith, especially for people in minority religious communities whose traditions or beliefs or practices may not be as well understood by neighbors and by mental health providers. So there's a lack of cultural competence or spiritual sensitivity on the part of many healthcare professionals. And that's mirrored, unfortunately, by misperceptions about mental illness and mental health care in many different faith communities. There's a profound stigma attached to mental health care in some faith communities. Certainly not all, and it's certainly true in secular communities as well. People of faith are certainly not alone in this, but there is still a kind of negative moral judgment about mental illness in many faith communities that I think stands in the way of the kind of open conversation that we need to have and that we're promoting today. And then finally, there are just deep structural gaps in our mental health care system. The system too often does not reach the people who need care the most. This has been just painfully true during the COVID pandemic. In New York, at least, New York City's Black, Latinx, and immigrant communities have been disproportionately impacted by the pandemic. I mean, the numbers are terrifying, and the impact of, frankly, structural racism on the kind of pattern of spread of the COVID pandemic has just been horrifying. But at the same time, these are the communities that have the least reliable access to mental and physical health care. So there's a lot of work to do. There's work to do, and we'll do some of it today, but beyond that, there's a lot of work to do to build on the sentiments that are expressed in these scriptures that I've been sharing, and strengthen the life-saving links between faith and mental health in all of our diverse communities. One last image to share, and this is in the form of, honestly, a shameless plug for some work the Interfaith Center has done. Last spring, soon after the first wave of COVID hit New York, ICNY, the Interfaith Center of New York, worked with colleagues of ours in city government and with another nonprofit, New York Disaster Interfaith Services, or NIDIS. We worked to strengthen the links between faith and mental health by preparing a toolkit for local religious leaders to educate them about the mental health impacts of the pandemic and about the important role that they can play in supporting their communities. So it's like a 60-page toolkit that I will not go into in detail right now, but I'll put a link to that in the chat as well, along with that social media kit that I showed before. And let me now stop sharing these, but I'll share those links soon. So again, looking ahead for the next couple hours and far beyond, there's a lot of work to do. My deepest hope for the new normal after the COVID pandemic, as Rose said, like, what do we want to see in the new world that emerges post-COVID? When it comes to faith and mental health, my deepest hope is for greater understanding and more effective collaboration between religious leaders and mental health professionals in order to overcome the barriers to mental health care in diverse faith communities that I've just been talking about briefly. So on that note, I'm glad to introduce our four speakers. And I think, Katie, if you can spotlight other folks with me. Lovely. I'm glad to introduce Reverend Kendra Frazier. Well, let me start with who's here. I'm glad to introduce Mary Reagan, who is a clinician and educator at the Psychotherapy and Spirituality Institute. Rabbi Simcha Weintraub, also a clinician and educator, kind of freelance at the moment, but Rabbi Weintraub is the former rabbinic director of the Jewish Board of Family and Children's Services, which is one of New York's largest social service agencies. Reverend Kendra Frazier, the founder of Kind Consulting, which does trauma-informed community mental health work, and the former director of the Hope Center, which is a faith and community-based mental health program in Harlem. And then also Suna Kalim, coordinator of health engagement for the Scottish Achul Bayat Society. And Suna, I apologize if I've completely mispronounced the name of the Achul Bayat Society.
That's okay. It's Sana, and it's the Scottish Achul Bayat Society, so don't worry about it.
Okay, apologies. So thank you all so much for joining the conversation today. And with no further ado, I'm glad to turn things over to our panelists. So I'll ask Mary Reagan from the Psychotherapy and Spirituality Institute to speak first. And there's Mary. Thank you, Mary, so much for joining us.
Thank you, Henry. And thank you so much to Interfaith Glasgow for such a warm welcome already that we've received. I'm so honored to be a part of this panel. Thank you for inviting us, for inviting me and my colleagues at PSI to participate. As an organization, we live in the intersection between psychotherapy and spirituality, recognizing that for most people, spirituality is really an important value for them and also a resource in times of stress and crisis. So if spirituality has to do with meaning making in one's life, then the pandemic of COVID-19 is at its very core a spiritual journey. It has to do with a profound reflection on and perhaps realignment of one's deepest values as we deal with issues of mortality, isolation, fear, and anxiety. In the time that I've been allotted today, I'd like to just briefly deal with 3 points, 3 issues that have surfaced for me in the course of the pandemic. First, mental health professionals and for their clients, telehealth is our new reality. The shift from in-person meetings to remote sessions on Zoom happened literally overnight. The strangeness of this new way of working was immediately apparent, bringing both benefits and challenges. The chief benefit was that therapy could continue uninterrupted in a seamless way. Most of my sessions are video sessions. Some of them are on the phone. Research to date shows that mental health care delivered remotely is effective. And there is now a substantial literature base demonstrating that telehealth interventions work for a wide variety of problems and populations. To give one example, the Hazelden Betty Ford Foundation in New York City, whose mothership is in Minnesota, offers outpatient alcohol and drug abuse treatment. And since the start of the pandemic, has had a full line of virtual behavioral health programs right from the start. And so this kind of remote treatment has been essential in the time of COVID-19, and maybe particularly essential since the issue of addiction is so important as people are in lockdown and in isolation. Telehealth allows people to come in from distant areas who otherwise would not have been seen. I've had a handful of clients, former clients, return to therapy with me, some of whom moved out of New York City years ago, but now, since they don't have to travel here for an appointment, are free to return. More importantly, telehealth has the potential to address the needs of people in areas of the country that have few resources for mental health. This raises the issue of a central challenge with this mode of working, which is the digital divide. Those who have access to computers, broadband, wireless connections, and those who don't. This is not only an economic divide, it's a racial divide, it's a generational divide. One of the churches in New York City that PSI partners with on occasion, the Church of the Heavenly Rest on the Upper East Side, is really doing wonderful work in addressing this issue of the digital divide. They are reaching out to create communities of care. Using funds that they have raised, they were able to get broadband to about 12 churches in Harlem and the Bronx, so that those churches could live stream their services and meet the pastoral needs of the congregations. I would suggest that it also meets the mental health needs of those congregations, since body, mind, soul, and spirit are one. As a church, they've also crafted a statement of intent in which they commit themselves to seek out Black and minority-owned businesses as their vendors of choice and are reviewing their hiring practices as well, with an eye to making a difference where they can. So these are just some ways that some members of the faith community have been reaching out. A second issue that has become very clear and which I expect will persist for a long time is that of separation and sometimes estrangement between families and friends, neighbors and coworkers as a result of political polarization. We are in what some would call a post-truth era, an era of alternative facts. As Alice in Wonderland would say, words mean what I want them to mean. This polarization is not relegated just to the United States. There is, after all, Brexit. So we as mental health professionals and faith leaders need ways to keep the conversation going. We need to find ways to create communities of care within and across diverse populations. When you consider what happened in the Capitol in Washington, D.C. 2 weeks ago with a violent assault on our Capitol from domestic terrorism, we understand that this issue of polarization is wide and deep and is not going away. And the faith communities and mental health professionals need to be in the forefront of addressing these issues as well. Finally, I want to speak to the issue of grief. Not as a mental health challenge, though it may be that, but as a human issue. The death toll in the United States as of January 2021 is over 400,000 lives lost. That's 400,000 grieving families, husbands, wives, children, colleagues, friends, neighbors, coworkers. COVID-19 has meant that families were unable to be with their loved ones. FaceTime has replaced holding the hands of those we love as they died. This inability to say goodbye, this inability to bring resolution and an ending to the ending, the inability to hold and to comfort, creates complicated grief, compounded by shock and trauma. It leaves people potentially vulnerable to what the poet May Sarton has called mourning without end. Our country is awash in grief. Faith leaders could provide only a pale reflection of the rich liturgies and rituals that people lean on when grieving. For those of you who saw the memorial service in DC the evening before the inauguration, you saw an exceptionally beautiful ritual. It consisted of poetry, prayer, silence, and song. The visuals were stunning, with 400 light boxes shining in the reflecting pool. It was the first time that we as a country stopped to remember and mourn the victims of COVID-19. Faith leaders are on the front line of creating and holding the space for this kind of remembering, as are mental health professionals. I would like to close with a poem by a woman named Lynn Unger. Lynn Unger is a Unitarian Universalist minister, and her poem is entitled Pandemic. What if you thought of it as the Jews consider the Sabbath, the most sacred of times? Cease from travel, cease from buying and selling. Give up, just for now, on trying to make the world different than it is. Sing, pray, touch only those to whom you commit your life. Center down. And when your body has become still, reach out with your heart. Know that we are connected in ways that are terrifying and beautiful. You could hardly deny it now. Know that our lives are in one another's hands. Surely that has become clear. Do not reach out with your hands. Reach out with your heart. Reach out with your words. Reach out all the tendrils of compassion that move invisibly where we cannot touch. Promise this world your love, for better or for worse, in sickness and in health, so long as we all shall live.
Thank you, Mary. Thank you so much for sharing that poem and for all of your reflections. That was lovely, and I always learn from you whenever we get to the privilege of working with you. I want to next introduce Reverend Kendra Frazier of Kind Consulting and formerly of the Hope Center Harlem. Katie, can we spotlight Kendra? Hi, Kendra. Nice to see you.
Hi. Great to see you again too, Henry. Thank you, Interfaith Glasgow, as well as ICNY for curating such a necessary conversation today. Mary, thank you so much for your thought-provoking words. I am grateful to share in this panel with colleagues and appreciate the work that you all do. This past year was a global experience felt by many as shock, a deep loss, a violent tearing away, a huge endeavor in releasing, a breaking down, a building up, a dark night of the soul, desolation, an opportunity, horrendous challenge, yet with unforeseen gifts. And this listing of the dualities of living in the grip of COVID is not exhaustive. I experienced the rigor of swift adaptation to the pandemic's mandate of being sheltered in place, and the anxiety of having to be indoors juxtapose the need for fresh air on my New York City block, where numbers of those contracting COVID were on the rise March through June. I felt the weight of leading a mental health facility and finding ways to ensure services were maintained, whether through teletherapy or virtual check-ins and mindfulness experiences, and continuing to move forward and training lay leaders on how to offer trauma-informed care through video conference platform. In light of also teaching motivational interviewing to first-year social work students and creating my first virtual fundraiser, I tiptoed to the limits of my mental health capacity, attempting to maintain a rhythm of life that was no longer available. I realized it was imperative that I get in the flow with the new rhythm this pandemic was inviting me toward, one with slower syncopations and the release of expectations for normalcy as I once knew it. Our collective rhythm, if we're honest, and sense of normalcy was disrupted. And we were all invited to a slower rhythm that made many of us aware of the areas in our lives that were due for reevaluation, to begin assessing how we've been showing up in our families, our workplaces, and ultimately in our hearts. To ask ourselves the questions of, have we been honoring ourselves in the midst of our serving? For others, the pandemic exacerbated the propensity to be violent, leaving children and adults alike behind locked doors with their abusers. An article in the New York Times published June 9th last year highlighted that child abuse cases dropped 51%, and that the authorities were very worried. As teachers are typically the leading mandated reporters of suspected abuse, often accessing authorities when they see signs of abuse. Is there an unseen epidemic of abuse at this time also? Still others have experienced a level of heartbreak that was almost unbearable, whether it was discovering that you and your spouse or partner were in need of separation or divorce, or you were let go of at your place of employment, or coupled with the deaths of multiple loved ones, or even the loss of connection. While others have experienced in this time starting new love relationships, opening new businesses, and finding a renewed purpose in life and in our world. This past year came with great mystery and uncertainty that coalesced with the violence of racism and a presidential office that was the manifestation of who we are. A collective of human beings caught in perpetuated generational trauma of our foremothers and forefathers that continues to look like classism and patriarchy and heterosexism, homophobia, transphobia, and gender discrimination, as well as the zip code to health paradigm. Through research, the zip code to health paradigm reports that health outcomes are determined by zip codes, revealing that zip codes heavily populated by communities of color have increased risk of health disparities due to lack of access to health and wellness resources. Given the aforementioned challenges, it is no surprise that depression, anxiety, and trauma continue to rise, particularly within the African American community, with the demand of mental health resources on the rise. While serving as the executive director of the Hope Center, we witnessed our already high wait list of maybe about 80 folks month to month increase exponentially as more people began experiencing the death of family members, the loss of day-to-day functions like physically interacting with other human beings or being able to leave the house unmasked. Those receiving services at the Hope Center who also had a disability found it more difficult to access resources, as so many hotspots were being sent resources from other locations that left some communities under-resourced. It became very clear that many of our institutions needed a plan for how to increase effective capacity for care across fields of health, mental health, wellness, and faith. In my former capacity as the associate pastor of congregational care and wellness at First Corinthian Baptist Church, I created a 3-track training curriculum titled Becoming a Trauma-Informed Church for lay leaders in 2018. The first track is a general trauma-informed track, teaching leaders how to realize, recognize, and respond to the signs and symptoms of trauma, as well as how to resist re-traumatizing parishioners and those in our community. And additionally, it taught the signs and symptoms of depression, healthy communication skills, how to de-escalate crises, and lastly, how to engage in holistic self-care. The second track introduced lay leaders to the micro skills of motivational interviewing, and the third track, which is to teach lay leaders how to facilitate support groups for those experiencing depression and anxiety under supervision of a licensed clinician. The necessity of this training curriculum within faith institutions became more apparent in the midst of COVID. It supported the church in capacity building in terms of expanding the skill set of our lay leaders, who most times are the first responders to the needs of parishioners. Those who participated in this training were also able to host 30-minute listening sessions with parishioners wanting to be in communication with ministry leaders throughout the months. This also became a practice of the Hope Center, conducting listening sessions for charter schools in the New York City area, particularly East Harlem Scholars Academy, and working with their staff. In addition to these highlights of the innovative ways we were tackling care in our community during this time, I also witnessed the burnout of colleagues who were also religious leaders, and it's seeming to loom more closely, and many of us inviting those we shared in ministry with to become a larger spiritual presence, whether serving as deacon, trustee, minister, or parish clergy. Based on my experiences over the past year, my hope is to envision a world where more capacity building programs centered in education around mental health are created for community members to become certified health advocates in an effort to increase and expand access to mental health and wellness resources. We must recognize that not everyone has the resources to attend an academic institution nor pursue licensure. It is important for the mental health and public health fields to envision innovative ways to build capacity within undersourced resource communities, so these same communities can be more empowered to help themselves. Lastly, it is important for us to consider even more deeply integrating anti-racism training within the onboarding process of our institutions generally, and faith institutions more specifically, particularly those who desire to be allies in saving Black and Brown lives. I also believe it prudent that these systems named work collaboratively to do the diversity and inclusion work necessary to see humanity within the wide spectrum of gender and sexuality. The Faith Coordinating Center is created through a Gilead Science initiative to assist faith communities in being more intentional about HIV/AIDS prevention work, is an example of the collaboration between divinity schools, public health, and faith communities. It is my hope that even more faith communities can begin to release themselves from the comforts and restrictions of traditional theological positions that don't make room for the swift changes and nuances of our evolving world. I envision more partnerships across faiths to endeavor in the work of justice in the fields of mental health and public health. I also hope the more supportive resources are created for those that work in helping fields from nurses, physicians, and mental health workers to religious leaders. Thank you.
Thank you so much, Kendra. I really appreciate it. I love how your comments and in just the very brief 10 minutes that you had, you brought together a whole range of issues from, profound kind of theological and spiritual change to the kind of structural changes in healthcare, mental health care delivery that are needed. So thank you so much for putting all that on the table. And now Rabbi Simcha Weintraub. Hi, Simcha. Again, a longtime friend and partner of the Interfaith Center, as are Mary and Kendra, and the former rabbinic director of the Jewish Board of Family and Children's Services here in New York. Simcha, thank you so much.
Thank you. Thank you. Thank you, Henry and Dr. Lamkin, Dr. Rose, colleagues and friends in New York and Glasgow, and my wonderful panelists, fellow panelists, Dr. Reagan, Reverend Fraser, and Sona Kalim. It's really an honor for me to be with all of you today, Zoomily. So to begin with, the mental health impact, people have said it already, but describing it is, every time I try and describe what it is, it's an understatement. Widespread uncertainty, relentless fear, disabling panic, mounting anxiety. It really, the word which has been used is really right. The community has been traumatized and continues to be. And the definition of trauma for me is that the rug has been pulled out from under our lives. So the first thing I thought I would just label quickly is what I've heard from people individually, both negative and positive, and in the short term and looking at the longer term. First, on the negative side. In the short term, I've learned of aggression and rage, social withdrawal, incapacitating depression, stressed relationships, and maladaptive or destructive behaviors such as abusing close ones, misuse of food or alcohol, gambling, etc. There has really been an unsuccessful integration of the personal and professional dimensions of life for many people. In one of the support groups I lead, a woman who's an attorney spoke of the loss of time, but what she meant was the management and clarity of personal versus professional time, of purposeful time and fluid time, how to distinguish objective time and subjective time. Indeed, many others have described not knowing what day, month, or season it is, or not being able to recount what they did today. And of course, nurses and other healthcare professionals have described moral distress, which I think applies to many in the mental health community as well. And in some materials that Henry will post or link to, there's some discussion of moral distress on page 2. Now, about the longer term from the negative side, New York City, of course, was a super hot spot towards the beginning of the pandemic. And I heard about not only PTSD, but disabling shame, persisting guilt, hypervigilance, somatic sufferings of various kinds, as well as complicated and delayed grief, of course. People have expressed shame about not being productive. People have shared that they have headaches, stomach, back problems, shallow, constantly interrupted sleep, guilt over not being able to be there for those close ones who are ill, and numbness and the inability to fully grieve the expanding realm of losses, and I don't have to list them for you. Now on the positive side, in the short term, I've seen and heard remarkable acts of helping, of generosity, and of compassion. And these stories, I think, need to be shared for their healing and hope-building potential. From the recent groups that I've led and counseling that I've offered, I would also name a newfound gratitude, an impressive sense of resilience, and sometimes a necessary element of self-forgiveness. In the longer term, I think we have to talk about the phenomenon of post-traumatic growth, which has been documented and explored in recent years. The strength and coping strategies of some people actually change their own and others' lives, yielding a sense of purpose and pride, and bringing out some unknown or unacknowledged traits or obscured skills. For many, over time, they have deepened their spiritual lives, prioritized relationships, reclaimed nature, appreciated poetry for the first time, written short stories, experimented with color, pursued long abandoned studies online, and very significantly, I think, as was said earlier, confronted death's inevitability for the first time through personal and media discussions, print pieces, and more. This list of positive things as the long term develops is very impressive. Now that was about individuals, couples or families, but in terms of the community as a whole and society, in my community, as in so many others, COVID-19 has stripped bare, I should say, the epidemic of systemic racism and ingrained social injustice in a plain, frontal, irrefutable way. With COVID, we have seen and experienced how preventive health, diagnoses, prognoses, care, and treatment options are all impacted by skin color, as are education, employment, housing, social services, and so much more. Le plus ça change, le plus ça reste la même chose. The more things have changed, the more they have remained the same, and that's simply unacceptable. So in light of all these realities, I'm now going to just mention and newly acknowledged realities. I'm going to talk about what our new normal needs to focus on from my standpoint. I'm just going to name 7. First, in terms of domestic violence. Somehow, in the 3rd decade of the 3rd millennium in the Common Era, we have still not figured out how to protect the vulnerable. The surge in abuse and deaths as people were confined to quarters is not just another statistic to be swallowed. We must name this horror and shameful reality and engage and invest in education, advocacy, affordable housing, social services, and all the tools at our disposal. And let us not forget the particularly vulnerable, homeless teenagers, trans African Americans, the elderly, to name just a few. Secondly, there remains a great stigma, as has been said, around mental illness, leading to underground suffering and as if living. Individuals, families, and communities that live with a multitude of challenges are treated as too problematic, if not too demanding. There are reasons, in other words, why families don't have iPads, adequate nutrition, a desk to study at in a conducive space, and so on. And these huge gaps must be addressed as social and communal, not characterological challenges. Third, we must actively recruit and cultivate and support mental health and all healthcare professionals of color. Fourth, we must develop and refine the trauma lens of all healthcare, social service, and educational professionals, as well as clergy and spiritual leadership. Fifth, all of us, including mental health professionals, must consistently explore the historic legacy of racism, slavery, and oppression, and the ongoing experience of dehumanization, white privilege, and so on. Sixth, we must empower consumers of color through education, employment, mentorship, advocacy, and various means of self-actualization, including science, the arts, and the positive and responsible use of technology. And finally, 7, our society has indeed suffered from a death-denying and grief-aversive attitude. And this has had major challenges for our ability to help the dying and the bereaved to heal and to grow. There are some very substantive and transformative death education activities underway, and these must be expanded and refined to speak to different cultural settings and demographic groups. I've been asked to say a bit about what the pandemic has taught us about mental health care in the New York's Jewish community. Now, Greater New York, you should know, has probably about 1/10 of the world's Jewish population. It is an incredibly diverse Jewish community, not only in terms of secular, Orthodox, Hasidic, conservative, Reform, Reconstructionists, but Ashkenazi Jews from Western Europe and Eastern Europe, and Sephardic Jews from places like Spain and Syria. They are by far not all white, though that is still the majority, and they are certainly not all middle class or upper class socioeconomically. At least 150,000 Jewish refugees from the former Soviet Union live in poverty. So generalizing is impossible and unfair. But let me address a phenomenon that was and is so disturbing to many, and that is in the Hasidic parts of New York City, in Brooklyn and Rockland County, there were reports of masses of Hasidim joining in both daily and Shabbat prayers, as well as in certain funerals and weddings. To those in the general world, it seemed like a willful defiance of the CDC, the Center for Disease Control, the orders of New York State and New York City, not to mention an ignorance of health and cult-like mentality. And perhaps it is the case that these dimensions were a part of the picture. But I think it's important to understand the priorities and cultural realities of the Hasidic world. In addition to a belief system that underscores God's providential care of those who follow traditional laws, an essential commitment to follow the guidance of each sect's Rebbe, a scholar and interpreter of Torah and a sacred, revered, pious, and even saintly leader. In this part of the Jewish community, it's incumbent to pray, if possible, 3 times a day with minimally 10 Jewish men over 13 years of age, to study Jewish law and tradition daily and in community, and certainly to honor brides and grooms and to pay tribute to the deceased en masse. Now, probably you know that Judaism has always put the preservation of life as primary, as priority number 1. And so one is not only permitted, but required to break virtually any of the 613 commandments to save a life. But cultural norms, together with the voice of the Rebbe, may trump this in the Hasidic world. And this is not solely about impudence or disobedience. In fact, it's a very different kind of compliance and deference. Now, many of us in the more liberal spheres of the Jewish community couldn't accept this, and in fact wrote letters urging our co-religionists to wear masks, socially distance, not gather in large groups, etc., on the very strength of that overriding requirement to preserve life, pikuach nefesh. But we see how the power of faith commitment, community, and culture is very, very great, sometimes to a serious fault. In recent days and weeks, there's been a painful but noticeable shift in this problematic stance in the Hasidic community of New York. Now, please don't think that the rest of the Jewish community, modern Orthodox, Reformed, conservative, secular, etc., have rushed to therapists or support groups. There is still a stubborn stigma in the Jewish community reflective of that which exists in the general community, a self-consciousness about going public with depression, even clinical depression, which of course is an illness not of one's choosing. The Middle of the Road synagogue that I attend launched a Corona Cafe, a weekly Sunday night meeting for people to gather Zoomily to share struggles and helpful strategies for managing the prolonged and deadly pandemic. Though it is facilitated by familiar, highly experienced and familiar psychologist and a social worker, it took a number of weeks to gather even 5 people to come together. It has since taken off. We've heard many people say things such as, well, I mean, everyone is suffering and having to deal with it, and so many have it so much worse than I do, and so they don't take part. In the Jewish community in general, the pandemic has required emunah v'bitachon, which means I would translate as trust and security. And these derive ultimately from community and from tradition. So engaging in Torah study, traditional and original prayers, music, new and old, value-based guidance on self-care, acts of chesed, loving kindness, and sharing stories of these social justice advocacy, baking challah, celebrating the Shabbat and holidays with family and community via Zoom where that's permitted, and more things like that have buoyed and preserved individuals and congregations. We remain, of course, deeply concerned about those who have been particularly isolated, the physically ill, many with mental health challenges, those living with disabilities, the elderly, those suffering from domestic abuse, and others. What I want to do is, and since my time is running out, I want to end with a poem that will be on page 6 of the materials that will be posted. This poem is called, I Want to Live in That Garden. What if tonight we all went to bed and thought of our best version of ourselves? It wouldn't be true, of course, not in this moment and not tomorrow, not midweek, not next week, not even next year. But if we could picture it, it would be a goal we could live toward. It would be perhaps like the garden beds I prepared today, hoeing in fertilizer, last year's grass clippings, leaves. When I was done, the rows still looked like dirt, but such fine dirt it was for planting. I believe in our resilience. What is best in us is eager to grow, like the sunflower sprouts volunteering again this year. What if tonight we imagined the roots of our goodness? What if tonight we planted only those seeds? Thank you.
Thank you, Simcha. And, you know, as the saying goes, from your mouth to God's ears, I love that phrase, what is best in us is eager to grow. It's hard to hold on to that right now when, you know, as Mary pointed out before, so much dangerous and destructive stuff has been growing in American society, at least, and elsewhere. But I love that. What is best in us is eager to grow. And then with that, I'm delighted to introduce the one colleague that I haven't had the pleasure of working with in the past, but my new friend and colleague, Suna Kalim from Glasgow. Suna, thank you so much for joining the conversation.
Thank you. It's been an absolute privilege and an honor to meet yourself and everyone, from the panelists to the organizers to people joining in live through different parts of the globe. The reason why it's like for me, this is connecting in the sense of gratitude, which has been foundation for many people across the globe for during these very, very difficult and challenging times, and we're able to connect with each other in some sort of form. Yes, as the panelists mentioned before in their wonderful speeches of what's happening in the world and how the world has experienced this pandemic. Now, for me, I'm going to take kind of a different stance to this, a different slant rather, in focusing on kind of my own personal experiences of this pandemic. Now, working as in the kind of the forefront, working with NHS and other forms of frontline workers on the psychology side of things as a therapist. Now, there's as you might be aware that people are experiencing, including ourselves. So this goes for humanity at large, including other creations like animals and things. So again, this goes for all kinds of creations, that we are experiencing something we haven't experienced before, on top of the life challenges that people were experiencing, right? So this has kind of made to the forefront for a lot of people the fundamental question, I suppose, is what is my purpose of my life? Because you see a lot of death happening, a lot of grief, and the kind of the limitation and helplessness that I can't, hold my loved one, or, just like, Mary was saying, that unable to say goodbye, or the grief, or but saying in our traditional ways. Now that has been limited, or rather taken away from us as humanity. It is absolutely important, as everyone highlighted, and fundamental for every communities and the world at large to come together. Now, it's easier said than done, but what has this pandemic brought to the forefront is kind of the different prejudices that exist in our society, even in, you would say, in the 21st century. It's hard to imagine, but it is there. However, what has been helping a lot of people, and from the work that Interfaith Glasgow has been doing, as well as Scottish Allo-based Society, small things like setting up food resources groups on WhatsApp. Can you deliver this to there? Can you do this? Now, this is for people who are maybe not that active, to just even get involved and get to know what's going on at very minor level, which then adds up to quite major levels as well. So we're looking, as a kind of the wonderful saying goes, that charity starts at home, right? So it's all about focusing from the kind of in a nucleus, focusing first on ourselves and reflecting on ourselves and what's important to us from these experiences that we have gone through. So people have lost their jobs, had relationship problems, trauma, anxiety, depression, all these things that they probably haven't experienced before. There's societal issues, there's educational issues going on in educating our youngsters. That has been changed, with a lot of people not being able to give exams or have that human connection for small children. It's actually impacting at a very global level and in development of children as well. So again, it's once you come to think and reflect on the gravity and the depth of the impact this is happening on each one of us, it's actually quite scary at the same time. That, my goodness, it's happening. There's lots of grief going on. People are unable to do things. For example, I've had some of my loved ones, being diagnosed with COVID, and you feel so helpless. What can you do? So it has brought to the forefront that how important connection is, and connecting with people and animals and plants, right? And so on and so forth, with the world that we share with. It has brought to the forefront even the whole race towards finding a vaccine, right? The the vaccine in itself has been um, brought together by different communities, people from different faiths and background, cultures, gender, and so on and so forth, right? The list is kind of endless. Now, so this shows how important it is in these very difficult circumstances for especially the kind of the faith leaders to come together, because, there's lots of people who are, so again, I'm talking from not just from faith point of view, from even for people who don't have any faith. So it's really important to connect with each other, be it at large societal leadership, for different faith groups to come together. So for example, in the beginning of this presentation was different quotations that were coming up, and it was so beautiful just to learn from each and every one of different religions and faith-based groups. So this is what we need to do more of, is learning and growing together as communities and countries and humanity as at large. One of the things that's what I tend to kind of focus on is how it's impacted our well-beings, right? Now, the lots of issues have been raised already, so I don't want to kind of repeat myself in already addressing something that wonderful panelists have already highlighted, but it's kind of the well-being that is coming forward, which is our spiritual well-being, which is the most important well-being, because it's connected to our health, our physical well-being, our social well-being, our psychological well-being, as well as our occupational well-being. Because, for example, you're more likely to, make friends with somebody who's got maybe the same values or connection and things like that. So again, becoming more aware of how important it is to nurture our spiritual well-being, and this is why faith plays a fundamental role in during these very challenging times during the pandemic as well as post-pandemic. There's going to be lots of different psychological issues that are going to be coming in front of us, including grief and loss, and children, how they have been impacted by loss and bereavement, and not having human connection as you would in classrooms and educational settings, and so on and so forth, and or being connected or disconnected from their loved ones like cousins and so on and so forth, and friends. So we're looking at really a bigger picture, even the post. But then, however, it brings, it's really important to reflect in the here and now. What can I do as an individual to help my family? Okay, it all starts from home, and then working with, the neighbor, as in majority of the faith groups, including Christianity, is love thy neighbor. Who is neighbor? Is somebody who's in need. So again, so you're connecting at smaller levels, but then going quite major. One of the things that I absolutely love is how we have the ability to switch and turn, in these very difficult times, in coming together. Now, for example, I have my small nieces. They're the best psychologists for me. They're always telling me things, and can you do this differently? Have you thought of this before? I'm actually learning from them. This is what we need to adapt, is the openness of our minds. Okay. not having any, or trying to minimize the prejudice that exists within us, you know, in order to overcome the barriers that majority of us might be facing. People who are maybe from different ethnic groups or different gender groups, you know, are experiencing more problems because of their minority, on top of this pandemic, and having very small, short resources to mental health and well-being. So just, I'm a bit aware of time, just to kind of wrap things up, or rather, I'll be kind of finishing more on a quote, rather, that sits very profoundly with me, is that, as a saying of Imam Ali alayhi salam, who is one of the leaders in Islamic faith after the Prophet Muhammad, peace be upon him. So he tend to say something very powerful, that a hopeful person sees opportunity in everything, but a hopeless person sees difficulty in every chance that comes. So, bearing that in mind, you know, this is a time for a lot of reflection, and you know, let's focus on how we can improve ourselves, how we can help other people, how we can build on that love and compassion and that sense of humanity, coming together and helping each other, from as small as, you know, passing a smile to a stranger on the street, to working at communities at large, like faith groups and leaders of countries, and so on and so forth, and building on hope of something that's instilled in us, and we can, you know, make each other stronger rather than focus on our weaknesses. So I'd like to personally thank everyone, even on path of Scottish Afro-based Society. It's been an absolute privilege, you know, coming and connecting with everyone on different parts of the globe, and in particular to the organizers and the Scottish and Glasgow Interfaith group. And you know, we just hope that there's more events like this in the future for people to come together. And you take care of yourself, and thank you once again.
And thank you to our wonderful panel of speakers, to our facilitators, and to all of you for all your contributions to this important conversation. I hope it's a conversation that will stay with us and bear fruit in all our various contexts. Before closing tonight's event, as in previous events, I'm going to ask that we pause briefly and spend a moment together in silence to reflect on what we've heard tonight, to let our whirring minds quieten a little, and to help any seeds that we need to take away with us begin to settle and put down roots. So Katie will put a candle on the screen and make sure all our mics are muted, and we'll just hold that silence for 30 seconds. Thank you. Thank you all once again.